Hi, my name is Robbin Miller, and I am the host of Miller Chat. My guest today is Tina Grosowsky, Program Coordinator for the Central Mass Tobacco-Free Community Partnership.
Thank you for having me today, Robbin.
Thank you for coming back. So, thank you for, again, educating the community on what you do and the good cause that you do. So, because I'm new to this in terms of media, why don't you tell our viewers who are watching what you do for the partnership?
Thank you. Well, the Central Mass Tobacco-Free Community Partnership is a grant-funded program at UMass Medical School. It's funded through the State Department of Public Health. There are 7 other partnerships around the state by region, and we work on reducing smoking and secondhand smoke, and we do that by working on policy through the boards of health, and we'll talk about that a little bit later on. And we work on helping people to quit smoking with cessation resources. We work on smoke-free housing, make sure that everybody who lives in public and private housing has clean air. And we work with a group of high school students that do peer education called the 84 Movement.
Wow, sounds like a lot.
Yeah, we really are very comprehensive.
Well, obviously there's a need for what you do, because if there wasn't any issues or problems, you wouldn't be here. So let's talk about what is the issue with vaping. What are the dangers? What is it that we need to know?
Yeah. Well, it is interesting that smoking rates have gone way down, which is a really great public health victory, especially among teenagers as well. But a couple years ago now, in the fall of 2017, some young high-tech entrepreneurs in California developed a device which would help adults to quit smoking. And they were very successful with the device. It's called a Juul, and this is what it looks like. And the Juul is a very high-tech electronic cigarette. And all electronic cigarettes have a battery in them, and then they have a pod or a tank with liquid propylene glycol that has nicotine in it. And when you turn on the battery and heat it up and inhale, then you get the nicotine. And that's vaping in a nutshell. The problem is that the nicotine is in the substance of propylene glycol. It's not water vapor. Most young teens have the miscomprehension that they think it's water vapor. So we really have to dispel that myth, especially for parents and for teens. So the nicotine is in propylene glycol, which when it heated up, it forms an aerosol mist, sort of like when you use spray pan when you're cooking on your skillet. When you inhale it into your lungs, it can cause respiratory infections, bronchitis, pneumonias. We don't know in the long term what the effect is because these products haven't been around long enough for us to have the long-term effects. We know the long-term effect of smoking. There's no doubt about that.
It causes lung cancer.
That's right, and heart disease, stroke. So these products, while they're less harmful than combustible cigarettes, are not harmless. The other component to vaping is that they come in a lot of flavors. So the flavors are very attractive to young people. In the Juul itself, the nicotine content is also alarming because each flavor pod, which is what you call this little device, has as much nicotine in it as a pack of cigarettes.
A pack of cigarettes?
A pack of cigarettes, that's right. So young people tell us that they'll go through a pod a day of this device, which it's also very attractive to young people because the way that it was developed, the nicotine is a formulation called nicotine salts, which goes to your brain really quickly, so you get that hit of nicotine and kind of a little bit of a rush feeling. And then it's very smooth when you draw it in on your throat. So there's no bitterness, there's no bite to it, certainly the way combustible cigarettes are. So the propylene glycol is a problem. And then there's the flavoring. All electronic cigarettes usually come with some kind of flavoring. The Juul has 4 flavors that come with the kit. Mint is a very popular flavor. Mango is another really popular flavor. And how do they get this flavor into the Juul product and the other e-cigarettes? What I say is this is not fresh mango juice from Market Basket. So they use a chemical. The chemical is called diacetyl. And diacetyl used to be used in the microwave popcorn industry until microwave popcorn workers were getting sick. Oh. And when they did the research, they were getting respiratory infections and pneumonias. And they found out it was because they used diacetyl to make that incredibly wonderful buttery flavor in microwave popcorn. So you may have heard the term popcorn lung. That's the term that the industry gave to this syndrome of the workers getting sick. So the FDA came in and said you can't use diacetyl in microwave popcorn anymore. So where are they using it now? They're using it in all these electronic devices because these are not regulated by the FDA.
Did the chemical in the popcorn cause lung cancer in people? Did it have any adverse effects?
There was no lung cancer. We don't have any long-term data yet. But in the short term, they were getting respiratory infections and pneumonias and bronchitis.
So it's people that are making it, not eating it?
They were making the microwave popcorn because it's when you heat it up.
Oh, okay, got it.
When you heat it up. So in the factory when they were making it. So the FDA now puts age restriction on all tobacco products, but they have yet to put any other kind of restrictions on. Until very recently, they've been talking about putting restrictions on these flavored products. They just the FDA director just resigned last week. They just had a new FDA director, and so we'll see if he continues to go forward with the proposal of regulating the products. So in Massachusetts, we're not waiting for the FDA. As I mentioned to you, we work with boards of health that pass policy at the local level. So in Massachusetts, over 144 communities have passed a local regulation, as I was talking to you before, called the flavor restriction. This gets all of these flavored products and devices, including smokeless and including chewing tobacco, into an adult-only establishment, which means either a vape shop or a tobacconist. So we're not waiting for the FDA to come in and ban the use of these products or selling these products in stores. So the flavor restriction takes care of that. So many communities have put that into place.
And what's been the argument against it? Any argument against it?
Well, the retailers always come in and argue about the loss of business. And but the Board of Health that has the legal power and authority to make this regulation is chartered by the town to take care of people's health and not the business of a community. So there has been no loss of business in terms of a store being shut down. No. There's been no record of that they've proven to anybody. They may have some loss of business, but what we say is, but in 2019, to have a business plan that includes tobacco, you're not being very smart in your business plan. There's a lot more healthier products that people are interested in buying these days because people know the health effects of certainly combustible tobacco.
Well, I taught U.S. government, and I know there's always been the battle between too little regulation and too much regulation.
That's right.
I certainly understand on the federal level, based on who's in charge of the country, I totally get that in terms of less regulation, let business do what they want. However, as you said, it's up to the towns and cities to do it on their level, which they can, under the Constitution, state has their rights to do whatever they want to do.
Right.
Are those communities that passed the restriction, are they more progressive than others, or was it just just across the board?
It's across the board, and it is also because there was a lot of community education provided through our partnerships and through the boards of health. and community advocates that went to the board and said, you know, we'd like to see these regulations passed because we know the epidemic around vaping, and we'd like to see these products out of the convenience stores in our community. We also know that town by town, as these regulations are passed, along with other regulations such as the pharmacy ban, many communities passed a pharmacy ban, which again says you can't sell any tobacco products at all in a pharmacy, and then raising the legal age to buy tobacco to 21.
Mm-hmm.
So enough communities over the past couple of years have passed those two regulations, the pharmacy ban and raising the age to 21, that the state legislators decided that they would pass it as a statewide bill and then went into law. So now, starting this past January, just a couple months ago, you now have to be 21 in Massachusetts to buy any tobacco product, and all pharmacies are banned from selling any tobacco products, and that includes a pharmacy in a Walmart or a Costco. So that's pretty, again, comprehensive.
But on the flip side, they can always go online.
They can go online, and that was part of the reason of this epidemic, because the Juul company, up until right before Christmas, any child could go onto the Juul website, put in a birth date, have a gift card number, and then put in their address, and then have the product sent to the house. And if mom's at work or dad's at work, the child, after school, gets the delivery and signs for it, and then they have a Juul kit. Or maybe they have a couple of Juul kits because they had a gift card. And at the time, they were giving out lots of coupons. So you could get 3 or 4 kids, and then a lot of kids were going to school and then selling them. So the FDA did recently say to the Juul company, you have to stop, you know, selling online to minors. So they've put in age restrictions online now.
Good.
And even our own Attorney General, Maura Healey, here in Massachusetts, has gone after restrictions of Massachusetts online sales. So what we're hearing is that it's not as easy to get the Juul or any other electronic device online. It doesn't mean it can't be done, but it's not as easy as it used to be. The other problem with these devices, and there's some similar to this called dab pens or vape pens, is that you can get liquid THC, which is the element in marijuana that is activated, and then you can put either purchase cartridges that have liquid THC in them, so you can vape liquid THC.
Yep.
It does not smell like traditional marijuana, so young people can be in school and using the dab pens and vaping liquid THC either in back of the class or in the bathrooms. And that's a big problem because we know the adolescent brain is still developing, and we don't want to see young people either using nicotine or marijuana in school for sure.
Well, yeah, I can see that. I do see that happening. So basically, it's up to each town and city to basically get their local, either city council or their town meeting members to persuade the Board of Health and to decide what they want to do. Okay, well, they can always check with the other towns that have done it. I've seen a trend in Massachusetts when it comes to, like you said, tobacco over 21 or marijuana. If they find like a conglomerate of many towns starting to do it, then they will consider. If it's 1 or 2, they're like, okay.
Yes.
But yes, I think that's probably what it's going to take.
Yes, and we like to see, you know, contiguous towns. It's, you know, they'll work together sometimes to make sure that the border towns are also taking up the same regulations. And we know that at the local level is the strongest support for these regulations. Yeah.
Well, I think it's definitely a good cause. Not to say they can't get it other ways, but it's a good first step in trying to prevent young people under 21 from getting it.
That's right. Youth access. It's restricting the access to young people.
You know, one of the things I teach social problems, and one of the things that the students are going to learn on the college level is when you have a social problem, do you want to eliminate it or modify it or reduce it? So I don't know if we can ever eliminate it. I think it's like alcohol and drugs, you can't really eliminate. You can only do what you can humanly possible in terms of regulations and education, you know, the public health model, as they say. I think it would be a way to help reduce it. through education. Because I'm realizing as I teach the class that really it's really hard to get rid of a social problem at 100%. There's other factors involved. But there's things that communities can do, like what you do in terms of education and obviously regulation.
Right. We know how to reduce smoking because we've done it.
We've done it.
Right. Rates for smoking combustible cigarettes are way down. There's still areas that have higher smoking rates, and Central Mass is one of them, and that's one of the reasons why we're working so hard on this issue. But we know that, so we know it can be done. So now we need to take the same strategies that we use to reduce smoking and use it to educate people and put in regulations around the vaping products.
Yeah, I mean, from a cultural competence perspective, there's different cultures that use it in their country, and then when they come here, like I said, education is the way to go. And they can decide anybody can decide what they want to do. Either they're going to listen or they're not. It's really up. But what I'm interested in as a parent is that, you know, people who would do it in a household, I guess if they are 21 and over, you know, you want to be aware that you're still raising kids. You want to be all there when you're taking care of your baby, your child, your pet. So it's really important to, if people want to do it over 21, I guess try to do it when the kids are not around, I guess. You know, or the pet's at daycare, like my dog, my therapy dog. Because, you know, like with anything else, smoking, marijuana, alcohol, people who are 21, especially parents, you know, you want to use, you know, you want to be judicious about how you choose to engage in that behavior to make sure it doesn't affect people around you, right?
So just like if someone's smoking combustible cigarettes, you want to take it outside if you have children in the home or pets in the home, and the same is true for these products. You want to take them outside. The other statewide regulation that or bill that was passed into law in January was including vaping in the smoke-free workplace law. So any place the smoke-free workplace law is in place, there's no vaping allowed either. So that's in just about everywhere nowadays, movie theaters, restaurants, you know, the mall. So certainly if someone has children or somebody has a pet, we recommend that they take the vaping outside and to educate themselves again about what they are inhaling into their own body. Yeah.
Yeah. Oh, pregnant.
Yes, we know that secondhand smoke is not good for pregnant women, and smoking is not good for women. We know that, it's irrefutable. Vaping, the same thing. You're inhaling chemicals into your body, so we know it's not good for pregnant women. Nicotine as a drug elevates your blood pressure, so that's not good for pregnant women.
Right.
And we don't know the long-term effect of it as well. The secondhand vape, it's not smoke because nothing is burning, but the secondhand vaporized oil does have trace amounts of nicotine and other chemicals because there's again, the device is heated, so when you heat it up, the propylene glycol, those trace elements of benzene, formaldehyde.
Yes.
So we know that's not going to be good for anybody, and certainly for a pregnant woman.
Do they know the effects of vaping on people who take medications, prescription medication? Do they know the contraindications yet?
I'm sure that if a person is taking other medications, they should definitely be talking to their provider if they're going to be using nicotine or using these vaping devices, because we know that nicotine is a drug and can affect the intensity or the strength of other drugs that you take.
And also, have they had records of overdoses on vapor yet?
Yes, they have, especially with young people. Again, the adolescent brain is still developing, so we've heard reports, and I've heard from school nurses, that, again, with the Juul, you're getting a lot of nicotine in, and that some young people have symptoms of nicotine overdose or poisoning, nicotine poisoning. So they've had to call, you know, ambulance and take them to the hospital. Just the use. So that's a serious issue. Even just using nicotine over the day in school, kids report feeling dizzy, nauseous, having headaches, a lack of focus or concentration. Not things that you want a student in school to be experiencing if they're going to be a good learner. You want them to be able to focus and pay attention and follow directions. to be a good learner. So the nicotine impacts the adolescent brain.
Yes, I'm aware, like I taught my social problems, the limbic system is obviously more functional than the neural cortex. But one thing I did raise the question when we were talking about other issues about, it's just responsibility. You know, when you're making the choice to do these things, I know they say it's the limbic brain, I get that. But I think at some point, adolescents also need to have some responsibility too. So that's something that's debatable right now about taking responsibility, knowing the circumstances based on the function of the brain. My day, you were responsible no matter what. Now it's like, okay, how is the brain developing? I get that, I understand that, but I think there has to be a line in terms of, you know, if biology is destiny, so to speak, then what is the responsibility of the individual? Willpower, you know what I mean?
And you need to,
Yeah.
that's why we need to educate young
Yeah.
teens about their brains are still developing, and to be able to educate them about postponing first use as long as they can until their 20s for any drug, until their brain really has developed more. So that's something that's really important for school administrators, for parents to know that the more we educate children about this and teens about this, then the more information and facts that they know.
Well, I know the data has shown if you did not abuse drugs before 18 and you did it later on, they said the effects will be different because it wasn't on the developing brain. That
That's
I did
right.
hear about. I did
Yes.
hear about that, and I did read about that. That I did hear based on MRIs. So yeah, I think in terms of what you're trying to do in education, it's definitely important in moving forward. In terms of any prevention efforts going on between now and then, any public social media campaign, a billboard? How about a billboard? Anything coming up with
Well,
that?
it's interesting you asked that. So actually coming out at the end of March, beginning of April is a new statewide media campaign aimed at youth.
Good.
The new look of nicotine addiction has been out since the fall. That's for adults and parents. And we have the new website called www.getoutraged.org for adults and parents and school administrators. On the Get Outraged website, there's a school toolkit. There's curriculum for school health and wellness teachers to teach vaping prevention in schools. So that's been widely shared, and I'm sure you'll share it on your show here today.
Yes, they will show.
On the screen. And then, as I mentioned to you, we have a group of young high school students that work with a statewide organization called the 84 Movement. 84 stands for the 84% of high school students that did not smoke combustible cigarettes when this organization was started in the late 2000s. So they've kept the brand name, the 84 Movement, even though the rate of teens smoking combustible cigarettes who don't use has gone way up. It's like 92% now. So they work to educate their peers, and they get trained in leadership skills and public speaking. And on a day called Kick Butts Day, that happens every year, they go up to the State House and talk to the legislators. And that's how the legislators learn about what's happening at the local level from the teens. And they really advocate to get the legislators educated about these issues. And then that's how the legislators then took the effort to pass that statewide policy around 21 and the pharmacy ban. So with that Kick Butts Day this year at the State House is going to be April 3rd. The new media campaign for youth will get launched on April 3rd. So that's going to be a new campaign for youth themselves to learn about these products.
And programs like these.
Yes, we're really grateful that you have this show to educate the Shrewsbury community.
Yeah, and I think I'm going to be doing Facebook. I'd be interested to see. And will they be producing public service announcements? Because, you know, you can send them across the state to public access stations like this.
Yes.
Like 30 to 60 seconds.
Yes.
I did one on school bullying, and for the last 5 years, they've been showing the different 30-second, 1-minute tapes on anti-school bullying.
Yes, I have a PSA that I can send.
Yeah, I think that would be great for families to see. I wonder if Amazon, because a lot of students, I work with college students, and a lot of them say Netflix is the in the Amazon. I wonder if that would be more of a federal thing.
Well, we are producing a new video. It's going to be a short 1-minute video aimed at education around this issue here in Massachusetts, and that should be coming out fairly soon as well. So that will be shared widely from the State Department of Public Health on their Twitter, Facebook, and could go on social media. Yeah.
Well, I think it's great, and I think what you said about that it's up to each town and city to ban the flavors. I mean, my challenge to residents listening today that we have a town meeting coming up in May. I don't know if it's too late or too early, but I think it's important to get together because I know that you all talk on Facebook and Twitter and talk at meetings and soccer games and everything else. Because my son plays soccer, so I know people chat.
Yes.
So my challenge to them is see if they can get a petition going to ask the Board of Health to outlaw it. I don't know if it'll happen now. I don't know how long it takes. But I think public awareness today is really important.
Right. So this is called the flavor restriction, and it's not a ban. That's an important distinction. Right, because you're not banning the products altogether. You're moving them into the vape shop or the adult-only establishment. So anyone under 21 cannot go into a vape shop. You have to be 21 to go into a vape shop, as opposed to a convenience store with any age child can go into a convenience store. So it's a flavor restriction.
And what are the 4 flavors on there? Mint?
So these are the Jewel products, come with a mint. This is probably cherry, mango, and then they actually have a tobacco flavor. So it tastes like a regular combustible cigarette.
Interesting.
Yeah.
Well, before we end today, please share any last-minute information, tips that I may have missed. Do you have any last-minute words that you may want to share?
Well, thank you for having me on, for sure. And again, the website for all the information about vaping prevention is getoutrage.org. And if people are interested in their town and whether the town has a flavor restriction or not, there's the state website, which is Make Smoking History, makesmokinghistory.org. And you can go on there to the drop-down menu and see your town and click on the town, and it will show all the regulations at the local level. So anybody who's interested, who's listening in Shrewsbury or in surrounding towns, can see if there's a flavor restriction in place in their town. So that's makesmokinghistory.org.
Well, I could say with certainty that I did look on the website, and I was very impressed with it. It's very informative. It's concrete, has lots of graphics, has statistics. So I think if you look at it, you will find to your satisfaction that you will be well educated about it. And obviously your information, phone number, and email address would be posted. Well, this has been another episode of Miller Chat. I thank Tina Grosowsky for coming on. Tina is the program coordinator for the Central Mass Tobacco-Free Community Partnership. Information about her, how to contact her, will be posted at the end of the show, as well as any other graphics that may be of interest to you. Well, good night. I'll see you next month.